Welcome to Bone Health for Women in their 20s and 30s. My name is Pam Geisel. I'm an exercise physiologist and the manager of performance services here at HSS, and I am joined by two rock stars. Uh, we have Dr. Jessica Starr, our HSS endocrinologist, and Dr. Deborah McInerney, our HSS clinical nutritionist. So glad to have you both here. Thank you for joining us today.
Thank you for having me.
Thank you.
Of course, of course. So I just wanted to kind of kick it off by first asking, what is a strong, healthy bone? So I think we hear about it a lot, but how would you define that? And how do we know when we have strong and healthy bones?
I guess I can start off answering that. So I think that it's not such an easy question to answer just to start, because I think a lot of times people think they have very healthy bones and then they break a bone or have an injury that makes them sort of question that. And so I think it is something that's hard to know how strong is a bone. Of course, there are very invasive ways that we can determine that with things like bone biopsies. There are less invasive ways we can determine that with things like bone density testing, but that's actually not something that we do routinely, especially in young, otherwise healthy women. So I think you can assume your bones are healthy if you are a generally healthy person, if you're someone who's had a calcium-rich diet for most of your life, if you're a woman in your 20s and 30s, you've been getting regular periods since your adolescence, you can assume your bones are healthy. If you've never broken a bone, you can assume your bones are healthy. And I think the converse of that is true too. If you have risk factors that might be hurting your bones, then you might be the kind of person who should go ahead and do that screening bone density test, even as a young woman.
Now, since you brought it up, we'll just hop right into that. What are some of those risk factors that we should be looking for that are kind of red flags that, hey, maybe we should go ahead and get that checked out?
Sure. So I would say some common reasons that I see here at HSS and young women for why they even went and did that screening bone density test would be an abnormal fracture. So not someone who's in a high impact car accident or bike or ski accident and breaks a bone, but someone who has a lower trauma fracture, like they broke something doing something that maybe was a little bit physical, but the fracture is sort of out of proportion to the degree of the injury. I think other reasons people get screening bone densities include things like underlying diseases. A lot of our rheumatologists here treat patients with diseases like lupus and rheumatoid arthritis, and sometimes those conditions are associated with low bone density. People who take steroids for chronic conditions like Crohn's disease, colitis, those also are risk factors for hurting the bone density. Anyone who doesn't have normal periods, their period doesn't come regularly due to being an avid exerciser or due to health problems, those are people who are at risk for bone loss from estrogen deficiency. So also people who should be screened.
Got it. And now, Dr. McInerney, are there any other kind of red flags when you're in your practice that you often then refer a patient to get checked out?
Well, I think so. I work with one of the brittle bone groups, and even, seeing kids in this group and then up through adulthood, I'm often talking about peak bone mass age. And so people don't know what that means. So peak bone mass age is about the age of 30. So 30 is this number looming in the distance for a lot of people, or in hindsight, for a lot of reasons. But really, for what that means is the age at which your bones are able to take in and build the best, strongest bone. So like Dr. Starr just said, is if you have a calcium rich diet, and whatever that may be, if it's through food, if it's through food and or supplementation, then the idea is that you've been giving your bones, the largest mineral in the body, a good bank. You are building that skeleton as strong as possible from birth. And even if you're, you catch it a little later. And so kids that are milk drinkers is great for a lot of reasons. But as kids grow up, then they obviously look to different foods and a variety of foods, which is what we want. So I think it really just depends. Smoking is the other one. I see a lot of people that are smokers and excessive caffeine consumers. So people, if you're not getting enough of the calcium in your diet and you're an avid smoker and you smoke a lot, 10, 12 cigarettes a day, and you're not getting enough calcium, if you have an excessive caffeine intake, and I feel like there's caffeine now in drinks that never were caffeinated before. So people really just need to be focused on having, a few cups of caffeine a day. But I think that is typically those risks when I assess, in terms of you're not getting it through diet, you're not going to take supplementation. If you've had a fracture or you have a non-union of a fracture, it's not healing properly. And again, like Dr. Starr said, a fracture that is not really in relation to the injury. So it's just, those are typically the things that I would then say, listen, you might want to see someone for this. So, or usually it works the other way around. Usually they are referred to me after having seen, a doctor. So, but it has worked both ways. So yeah, but it is typically, I'm getting them after they've, sort of been assessed for the bone quality. So.
Right. And now I do have a question in terms of calcium, because we kind of generally know about calcium. We often eat calcium milk. So what are some of the things that calcium does for our bones, or the questions that you often get asked, that you think everybody should know about calcium and bone health?
Jessica, do you want me to go, or do you want to?
I guess we could both answer it. Maybe you go first, and then I'll throw in something.
I think so. Calcium, it is the largest mineral in the body. That's first and foremost. It is considered a macronutrient, meaning it is one of the largest nutrients that we need and that our bodies have. And so our bones are the bank of calcium. So if you haven't really been delivering it and building a good bank of it, then over the years, your body will continue to pull from that bank, and then it can really be left in a brittle situation. So that's first and foremost. And then I think that, it is not something that your body can make. Unlike vitamin D that people will talk about, the sunshine vitamin, your body cannot make calcium. So you need to get it from outside sources. So obviously any nutrient from a food source is best utilized and always the preferred source. But then you sort of have to figure out, if you're not getting it, then where you can make it up. So.
And I'm going to ask, what are those sources of calcium that we should be including in our diet?
So dairy, for the first and foremost, that is where, and dairy and when I say dairy, I mean milk, cheese, yogurt, and it could be any of those products. Now more than ever, there are so many other alternatives. So for vegans, if you have a dairy allergy, if you're lactose intolerant, whatever, there is a version for you. What people should really know and be aware of, if people are not already food label readers, calcium is a government mandate. It is always on the food label in a percentage. Sometimes you'll see it in milligrams, but is based about on 1,000 milligrams of calcium. So if the serving is 30%, like standard cow's milk is, that equates, to 300 milligrams. So a lot of times people just will do a little inventory. I have them do an inventory, and I know Dr. Starr, you probably do have them do an inventory as well, of how much dairy you might be getting in your diet. I mean, you have to be careful because you still need variety. There are other nutrients that are still necessary. There are a bunch of patients who it's like dairy, 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 and then all of the non-dairy sources of calcium. I'm like, where are your vegetables? Where's your other stuff? So, but that is pretty much where you get it. It is in all these milk alternatives. And the one thing that people should know about the milk alternatives is that they are sort of what we call hyperfortified. So they will have more calcium. Some of the brands have about 450 milligrams of calcium per 8-ounce cup. So it is a really good bang for the buck. So if you're using one of those, it's good. It's not, juice is another one that became, fortified in calcium. And if somebody drinks juice, I think, okay, then you can use the calcium fortified version, but it's not necessarily a reason that people should start drinking juice. So.
Dr. Starr, is there anything that you wanted to add about calcium, kind of the conversation that you may have in your clinic with your patients?
I guess I would also add that calcium, while it's a very important nutrient and, really number one nutrient for our bones, our body is actually not so efficient at absorbing calcium. So we think that our body can absorb about 500 or maybe 600 milligrams of calcium at any one time. So I also stress to my patients, it's very important not just to have calcium-rich foods, but to really have them throughout the day. Don't think you're going to sit down to breakfast with your kale smoothie and your, egg whites and your glass of milk. And okay, now I had my daily 1,000 milligrams of calcium, because you're not going to absorb it. And same for the supplements. If you're taking supplements, make sure that at any one time, you're not taking more than 500 or 600 milligrams, just because the body can't take it all in. And then you end up putting that extra calcium out in your urine.
Right.
Got it. So since we're on the topic of supplementation, should people be supplementing calcium if you find they're not getting it in their diet? And is there anything they should be looking for in those supplements if that is a route that an individual is taking?
To try to build those good habits now, those nutrition habits now, because like you said, is that if you start doing a calcium supplement remember, the supplements are meant to fill in the gaps. And if you're vegan and you're not really, getting it from food, okay. But the idea is not to rely on a supplement for a specific nutrient, or to, and so you have nothing in your diet whatsoever. Because the thing with dairy as well, or any of the alternatives, but it's really dairy, it has natural calcium, it has a little bit of vitamin D added, which is what helps absorb for your body to absorb calcium, but it also has some protein in there. So it's a really good kind of all-in-one food, and a lot of it comes in its own little packaging. So it's really easy, but you do want to kind of create those good habits now. So I wouldn't necessarily say, I try to give people, especially when I see patients post-op and they've had a fracture, listen, if you're going to eat food, you may as well try and get more from food, because also it's going to weed out the excessive supplementation or the excessive consumption at one time. Because there are plenty of people, take their calcium supplement in the morning when they have yogurt or when they have cheese or when they have whatever their dairy source. And then I'm like, oh, you're supposed to space it out. That's why the calcium supplements max are about 500-600 per pill. So, proceed with caution, I
I
would
actually
say.
never knew about spacing it out, so I'm
Yeah.
definitely jotting that down myself.
Yeah.
As
Yes.
as I fall in this age group. So I think one of the important things that I particularly came across in my circle of friends is kind of birth control. And what effect does that have on our bones? Is there any guidance that you give to your patients? But I think this could be something that we often see in this age group.
So I guess like
Absolutely. I mean, I would say that by itself, birth control pills or like the NuvaRing or the Mirena IUD, those don't hurt the bone. From all the research that we've done, even the low estrogen containing birth control pills have not been clinically proven to increase fracture risk or to hurt bone density. The Depo shot, Depo-Provera, that actually has been shown to hurt bone density, especially when women are taking it when they're new to having their period, so in early adolescence, and when women are nearing menopause, like in their late 40s. But what I think the bigger problem is with the birth control pills is that women go on the birth control pills when they're not getting their period regularly as a way to get regular periods. But the underlying reason why they're not getting their period never gets addressed. So if there's a nutritional deficiency, if someone doesn't have enough calcium or enough protein in their diet, and that's what's leading them to not get their period, and you throw on the birth control pills, yes, they'll then get regular periods, but you're not fixing the underlying problem. So whatever negative bone effects the dietary calcium deficiency is having is not being addressed. And that's where I think things can get a little bit messy with the birth control and the bone health. I think if you go on birth control for contraception or you go on birth control because your periods are very heavy, but they're occurring regularly, then that's fine. But if there are some other medical problems going on making a woman not cycle, I think it's important to address those problems because that really is what can hurt the bones.
Got it. That makes a lot of sense. And now moving on from kind of that birth control, when we get into kind of pregnancy and specifically breastfeeding, what has the research kind of shown in terms of bone health during these periods of our lives? And is there anything that we as women should be doing to help supplement or counteract any sort of changes that happen?
Absolutely. So I think it's a very interesting physiology and it has been extensively studied. So pregnancy is a high estrogen state and estrogen is very good for the bone. So what the studies have shown is that women's bones actually get very strong during pregnancy. And then when a woman delivers a baby, the estrogen levels go down to zero. So then that's a time where you're at increased risk for bone loss. Now, in the past, there was this theory that breastfeeding, especially prolonged breastfeeding, parents who had multiple kids and, continued to breastfeed for years and years, there was some thought that maybe that did hurt the bone. But the newer research shows actually that that's not the case and that the bone loss that happens with breastfeeding actually does improve with weaning. However, breastfeeding is a state of negative calcium balance. And so it's a time in a woman's life where paying attention to calcium rich foods is even more important. And we know that the effects of breastfeeding on bone density reverse in 1 to 2 years. So something I would say to breastfeeding women out there and actually to colleagues of mine ordering bone density tests is don't order bone density tests in breastfeeding women because the results can come back as low and then it will make somebody very nervous. And it's something that's a normal physiology. They actually have done these studies where they check a bone density in somebody and they check it again when they're breastfeeding and then they check it again with weaning and they see normal, decrease, normal. And so that's important to know too. But definitely breastfeeding is another time in your life, in addition to those, ages between when a woman is in adolescence, getting her period up until age 30, building peak bone mass, focusing on calcium. I think another time in life to focus on calcium is during breastfeeding.
Got it. And now, what about you, Deb? When you have those individuals, are there any common questions that women bring up to you, or any kind of tips? Because they're obviously in a period of life where they are probably just feeling a little sleep deprived and, probably not eating the same foods that they were previously. So are there any tips that you provide to help encourage those complementary
Well,
foods?
I think that one of the also things to think about during that period of time is, the calcium needs really fluctuate, especially for women throughout the lifespan. So they're low as a baby, infant, baby, toddler, then they continue to go up during adolescence, and then they sort of come down when you're done growing and they're about 1,000 milligrams. But then if you're pregnant, they will vary then during pregnancy with any sort of hormone changes. So then your calcium needs are constantly fluctuating. And then if you have a fracture, your calcium needs will go up a little bit for a period of time. So I think, again, what Dr. Starr said a while ago about really trying to work on your diet quality now, because it's really difficult if once pregnancy comes to all of a sudden start doing it. It's a lot of stuff to have to deal with. So if you
Yes.
have a good foundation, it makes those things a lot easier. And so you're going to, constipation typically is an issue because everyone's on a prenatal and it has iron and calcium, and those are both constipating, and they actually compete for absorption, and they're absorbed through the same channels. So you get a little bit of more, one of the other, something like that. So if you can get it through diet and space it out, and also, there were a few employees during the past year, especially during the beginning of COVID, who were pregnant. And two of them were diagnosed with gestational diabetes. So they had this challenge of like trying to keep their blood sugar levels normal, but continue to gain weight, but not in an unhealthful way. And my favorite thing is like string cheese. Like it's always comes in a carrying case. It has a little bit of protein, a little bit of carb, a little bit of, calcium. So it's a great little snack to keep with you. And it really helped one of the women. She was like, oh my God, there was a savior, because she's a physical therapist. She's like, I don't have time to be just like going back to the office and having a meal or having a snack. So it's those little habits that are just then it's all about behavior. So it's all, it's a new behavior, you increase, you change the behavior, it becomes a standard. And so then it's not as much work when something else needs to then, change. Or so I try to facilitate it as easy as possible for people, because if you can try to make these changes now and lay a good groundwork, a lot of the stuff doesn't have to be as effortful going forward.
I'm also writing that down. String cheese, spacing
Mm.
out my calcium.
Yeah.
Great.
Yeah.
Perfect. So now what can we do besides food and our diet to help build the bone health that we're really looking for? So what else falls in those buckets that we should be incorporating? Deb, do you want to start?
Well, physical activity. So weight bearing activity. I think that everyone, if you're young and healthy, we see a number of people that are unable to do any physical activity. So it always makes me annoyed when I see people waiting for a bus that actually can walk. So this, it's one of those things, your muscle is what supports your skeleton, but your weight bearing activity in particular during these younger years really does help kind of keep the mineralization in the bone. And so that's primarily, I don't know what else you have to add, Jess. So.
Yeah, I definitely agree. I think weight bearing exercise, especially in those years that women are building their bone, is very important. And I think, weight bearing exercise and what exactly that means is often a question I get asked. It's not necessarily you have to sit and do weights and, have that kind of anaerobic exercise. Even something as simple as walking, the weight of gravity bearing down on the skeleton is important. And I think if it's something that can be done that incorporates some weights, it's even better, especially for anyone who knows they're at risk. Like if you know that your mom has osteoporosis or your grandma fell and broke her hip, and you're a woman in your 20s and 30s, I think, that's something to really think about, because we inherit a lot of the potential for low bone density from our relatives. And a lot of times when I see a patient in the office, I'll hear that history of, yes, grandma fell and broke her hip and mom was diagnosed with osteoporosis after menopause. And so I think that in a preventive sense, if you're a woman out there with that kind of history, it's even more important to have the calcium rich diet and do the weight bearing exercise.
And now, what is osteoporosis, Dr. Starr? Can you go ahead and kind of dive into a little bit more of like what that is, and maybe some particular risk factors that we should be mindful of besides the ones you just named?
Sure. So osteoporosis is basically the disease of weak bones, and pore is in the name, osteoporosis. And basically what it means is that our bones become very porous and they are more easily broken if you drop them. The bigger the pores are, the more easily the bone fractures. And that's osteoporosis. The sort of good and bad thing about it is that it's a painless condition. So good, because we don't want people to be in pain, unlike some of the other reasons patients come to HSS with, pain from arthritis and pain from injuries. This doesn't hurt. But what's bad about that is that people often don't know they have it. And that's concerning because a lot of times if you don't know about something and you're not screening for it, by the time it gets diagnosed, it can be very advanced. So I do encourage patients I see, even for other reasons, if they're postmenopausal, to have a screening bone density. And bone density really is the gold standard test to diagnose osteoporosis. Now, something sort of interesting about the diagnosis is that osteoporosis actually, technically, by definition, is only a disease of postmenopausal women. If you are a premenopausal woman, you cannot be diagnosed with osteoporosis. It's a different test result that we're looking at. We're looking at a score of your bones compared to your peers, which is known as a Z-score. And if your Z-score is as good as your peers or better, or is within 2 standard deviations of your peers, that's all considered bone density as expected for your age. But if the bone density is 2 standard deviations below your peers or more negative than that, you get a diagnosis of low bone mass for age. And that's sort of the osteoporosis of younger women, as we call it.
Got it. And now, what are the other risk factors that we should be considering besides family history in terms of kind of, again, just being mindful of bone health and our risk for us?
Sure. So I would say definitely family history plays a role. I think being physically inactive plays a role. And I would even extend that to prolonged periods of immobility. A lot of times we see what we call disuse osteoporosis. Somebody had a surgery, it was complicated. They were on their, they were off their feet for months, and you can see osteoporosis in different parts of the body that have been immobilized. So I think that's a very important consideration. I think kind of reversible considerations in young people are alcohol and smoking. So alcohol in excess is actually toxic to the osteoblast, the cell that builds bone. And smoking, we know, activates the osteoclast, the cell that breaks down bone. So those are things to keep in mind. And then there are a host of other medical conditions that increase risk for osteoporosis or low bone mass. Really anything that is a state of inflammation, things that affect intestinal absorption. So diseases like celiac disease, Crohn's disease, the rheumatic diseases with inflammation like rheumatoid arthritis and lupus. Certain medications really increase risk for osteoporosis. So steroids, which I think doctors use less and less these days because we know that they have a lot of negative consequences, but steroid use really also increases the activity of the cells that break down bone. We know certain other medications are associated with bone loss, certain kinds of chemotherapy, certain seizure medicines are associated with bone loss, certain water pills that we use have been associated with bone loss. There's some talk of a link between proton pump inhibitors and selective serotonin reuptake inhibitors, also known as SSRIs, and bone loss. And that's particularly concerning because a lot of patients, especially now with the pandemic, are taking medicines for anxiety in the Prozac and Lexapro family, and people are taking medicines for acid reflux like Nexium and Protonix. And I think that the data for those 2 medicines, actually, I will say, is less clear. I usually try to reassure patients when I see them on those medications, because the studies that showed that there was a link, it was really an association study. So the same people who took proton pump inhibitors and took selective serotonin reuptake inhibitors were people who had osteoporosis, but no one has ever proven that taking those medicines causes osteoporosis, the way we know that taking steroids does cause osteoporosis. So that's something that I usually help reassure patients about, just since it's a medicine so commonly used in our society.
No, that's super helpful. And now, I know you touched on alcohol and the role that it has in the osteoblast. Are there any other foods that are bad for our bones, or that an individual should be kind of restricting in their diet?
I mean, we definitely worry about coffee and caffeine in excess, diet sodas in excess. I think having a little bit in moderation. Say that across the board for diet, eating too much of any one food is probably not a good thing.
Yeah, it's also right. I mean, that's why we talk about variety and moderation, but it's the colas also, not just diet soda. So, and I think because I hear a lot from patients, oh, well, I don't drink anything carbonated because of my bones. And I'm like, well, it's not seltzer, it's not bubbly, clear, non caffeinated fluids. It's the phosphorus in cola really that does it. But the other thing too is that kind of goes along with all of that soft drink uptake is when the soft drinks kind of boomed in the 80s, the milk drinking decreased. So there is a correlation that, the kind of generation up and coming now, they're not really milk drinkers. And I could have probably been like one of the last milk drinking, generations, but everyone, it's one of the questions I ask most people now, if we're seeing them for brittle bone condition or that have that have an adult with a fracture or something like that, that isn't really that advanced in age and at risk of osteoporosis. So it is something that, years ago we used to talk about all these other things. And so we don't really talk phytates in food, and we don't really talk about that stuff anymore because we just know more. And it's not, it's a little bit of everything. It's calcium, it's lifestyle, it's making sure you don't have, I saw a patient years ago, she would get she drank 8 black venti Starbucks coffees a day. And she was 42. And I was like, oh. And I'm not the type of person that's like, that's terrible. But I said, that's not good. I said, you need to cut that back. I was really horrified for her. But she was like, oh, that's bad. I'm like, yeah, it's not great for your bone health. No. The only good thing that she had in her corner was that she walked like 5 miles a day. So I was like, okay, there's like a little give and take. But yeah, you just, again, moderation and sort of making sure you're having sort of a variation in your intake. So
My parents made me drink milk every night at dinner, and I hated it growing up, but now I will drink them.
right.
They enforce
You should
that.
thank them, right? You should call them and thank them later.
I will. And so we've talked about all of these things that, and people may be sitting at home like, I am that person that drinks 8 coffees. Is it too late? Like, can you rebuild bone?
That's an interesting question. And I think it's something that also, it depends, where your bones are. I definitely see patients who have a little bit of bone loss. Maybe they were an athlete in high school and their bone density is technically normal, but it's like a standard deviation less than their peers. And then that makes me wonder, why is that? If you're an athlete, in fact, your bones should be better than your peers. Why are yours a little bit worse? Technically, those people don't have a disease. They don't qualify as low bone mass, but the numbers are a little low. And I think if we can find a reversible cause, if it's, a dietary calcium issue or their vitamin D is very low and we fix those things, I definitely think they can rebuild bone. But unfortunately, I also see people who have really, really low bone density, like their scores compared to their peers are, off the charts low. And I think for those people, I don't think it's a realistic expectation to think that their bones will go back to being 100% normal. But if you're in this window of building up to your peak bone mass in your teens and 20s, there definitely is room for improvement. And I think women like that can improve their bones a lot. Would they ever be 100% normal? I think it's less likely if your bones are very damaged.
Yeah, and I think that once you've hit peak bone mass and after, it's more of a game of holding on to what you have and slowing any sort of worsening or any sort of loss. So, because I've had some people with really severe osteoporosis say, oh, well, I'm here to make my bones better, but they don't want to take medication and they think they can do it just by getting enough calcium. I'm like, that is in fact untrue. So you don't want to ever get to that late stage. So it's never too late to improve things, but just through diet and exercise alone isn't necessarily, if you're past peak bone mass age, necessarily going to help the quality of your bone. You'll help it, but you're not going to necessarily rebuild it, but you will definitely help it worsening at a faster rate for sure. It is never too late just to, to help your bone quality, I should say.
Oh, that's great. Now, this is a personal question. Have you noticed, because we talked a lot about calcium, but what about vitamin D? And I feel like people often associate that with being outside. In the sun, have you noticed any trends kind of the past year with people being inside more and sitting at their computers? Like, have you noticed any increase or changes in kind of the individuals that are coming in due to the kind of the decrease in activity and increase in indoor activity over the last year? Or do you think you might see that down the road?
Well,
sorry, go ahead.
Oh, no, I was just going to say it's a little different for me because I think I see so many inpatient and outpatients with vitamin D levels available. And I think that vitamin D, if there was one vitamin that needed another push, was vitamin D coming out of COVID because of their function in immune health. So I think so many people I've seen now are taking supplemental vitamin D because they heard, there was a study that came out about, patients that did kind of worse with COVID when they got COVID all had low vitamin D levels. So people have been taking vitamin D that never really were taking it before, but it is one of those vitamins, it's very symbiotic, and calcium has a very symbiotic relationship. Your body needs it for calcium absorption, but people think, you know, because I do have a patient with osteogenesis imperfecta, which is the genetic kind of form of, you know, porous bone, and they don't take any supplementation and they just sit in the sun all summer. And their vitamin D will get to a normal range, not like a normal range for regular normal, not normal for optimal bone health. And then the whole year, the rest of the year, it goes down again. So yes, if you have sun exposure and it's a perfectly sunny, warm day, because really the last research showed that you need 30 minutes full body exposure without sunscreen because you need the UV rays. The point of wearing sunscreen is to block UV rays. So if you wear sunscreen, you are blocking out greater than 90% of the UV rays. So that is not going to synthesize the cholesterol in your skin to create vitamin D. So you in fact need vitamin D. Typically, most people tend to need supplemental vitamin D just to kind of get in the normal range. So it is one of these things that even though people have been indoors, because that was always one of the risk factors of low vitamin D was being homebound. But there are certain medications or just if you're not being active and sort of diet quality, it really just depends on the person. So I'm not necessarily personally seeing it in practice because I'm seeing so many vitamin D levels and I feel like recommending something every day. But I think it's just because I'm seeing a patient population that has vitamin D levels.
So if
So
someone is supplementing with vitamin D, is there anything they should be looking for in that supplement specifically?
so I have very specific, I mean, I'm pretty much like an over the counter. I don't love people self-supplementing, but vitamin D, we don't see vitamin D toxicity a ton. But with that said, I will tell you that so the normal range is 30 to 80 or 30, pretty much 30 to 80. I have seen a few people now greater than 80 because they're like, oh, I'm just going to take, it's fat soluble. So you have to be careful because your body will hold on and, store in your fat cells any that you don't use. And so really for optimal bone health, the level or, the goal is about 50. There's a 400 over the counter of cholecalciferol, which is D3. There's 400, 1,000, 2,000, and 5,000. So some people need to take it every day and can take like a general safe amount is about 1,000 if you don't know your level is and you've never taken it before. 1,000 is usually in the multivitamins like Centrum or one a day. But you would just have to be careful. You don't want to just start, I've had some patients that take 5,000 because their vitamin D level was low and they've been on it for 3 years. And I'm like, what are you doing? You need to have your level rechecked. You shouldn't be blindly supplementing. So that's kind of where I stand up.
Questions in this chat about vitamin D levels. They need to come and see you two to get those levels checked.
But even everyone, so I will tell you, because any general practitioner, if you go to see your primary care physician, you can certainly ask when you have an annual physical to have that level checked. Oftentimes they might say, what is the reason? And you just say, oh, I'm tired. Because basically fatigue, you want to make sure that it's not vitamin D deficiency because they do need to justify for insurance companies, why you're checking that. So that is one of the things, that I would just encourage, just so you know what your baseline level is, because it could be you take nothing and your level's 22, which isn't terrible. So like you would just need a little to push yourself up into normal.
And I think especially for anyone with injuries, people having stress fractures, people having other kinds of bone related injuries, people who are athletes, any breastfeeding moms, people pregnant, people wanting to get pregnant. I mean, a lot of people in this age group, I think would benefit from knowing their vitamin D level and potentially taking a supplement. And I'll also say what's interesting is that I tend to see vitamin D deficiency based on the season. So now April, March, even May, I see a lot of vitamin D deficiency because we're coming off the winter when people were really inside and there weren't good hours of sun exposure available to people. And then when I check these same levels in the same kinds of patients in like August, September, all the levels kind of normalize from the sun exposure. But truthfully, with the rates of skin cancer being where they are, I usually tell people while being in the sun can improve your vitamin D levels, given the skin cancer risk, it's probably just better to wear your sunscreen and take a supplement.
Yeah, I also feel,
so we are running low on time, so I want to just hop into the chat.
So
I'm going to kind of throw the questions
I guess,
out, and then you can kind of let me know if you want to take it. So the first one is if I'm on a birth control that gives me my period every 3 months,
If you
Does
want to
that
build some
affect my bone
support,
health?
super dynamic stuff.
So it shouldn't. There definitely are birth control pills like that, like Seasonique is one. And a lot of times people with painful periods, conditions like endometriosis, might lead a doctor to not want a patient to get a period every month. But technically a pill like that, if you're getting a good amount of estrogen, you're getting a good amount of progesterone, it shouldn't hurt your bones over time. The bigger question would be, why are you on that pill? Was it because, the patient was not getting periods at all? And if that's the case, and there's some kind of underlying estrogen deficiency, that gets into just the importance of making sure we look into the physiology of why that happened and making sure that if there is an underlying medical issue causing that patient to not get her period, that we address that.
And then the next question is, should I be concerned about bone leaching?
Yep. Totally. Yep.
Additional comment.
I
Bone
mean,
leaching.
leeching, like leaching bone being, bone loss, basically.
Mhm.
I mean, I think if, when I see patients, if they're a smoker, if they have an excessive amount of caffeine intake and not enough of the bone nutrients like calcium and adequate vitamin D. Yeah, I mean, I'm concerned, I get concerned, and so that's why we talk about the bone risks and adequate and good nutrition to make sure that you're getting what you need and maybe limiting the stuff that you don't necessarily need that would be risky for bone health. So, you just have to do a little bit of an inventory sometimes about what you're currently doing and where you might need to make some adjustments.
Mhm.
Dr. Starr, is there anything you wanted to add?
Right. So actually,
Yeah, I agree. I think, in terms of losing calcium from bone, basically what I tell my patients, and this is true, calcium is a vital nutrient for many important metabolic processes in our body. Like, for example, how the heart contracts, we use calcium for that. So the body needs the heart to contract to stay alive. And if the body sees that there isn't enough calcium in the circulation, it will just take from the bones and dump into the blood. So when you're thinking about things like bone leaching, what we worry about is there enough calcium for how the body functions metabolically? And then is there enough calcium for the amount of physical activity the patient is doing? And I think if those criteria are met, then the risk of bone leaching is lessened.
Got it. And then this one says, what do you suggest for young women who have low bone density due to nutritional deficiencies? Is bone restoration possible? Again, not any additional context, but.
I mean, I think it's hard without knowing exactly why the bone density is low. I would say a lot of the patients I see, if the bone density is low from some kind of reversible cause, I would say the first thing to do is fix the reversible cause. So if it's a nutritional deficiency, if someone's very underweight, if they're not getting their period, work on whatever factors are causing that to happen so that the patient is able to consume enough calcium, consume enough protein, cycle. And, that's really the important thing about your period and why the birth control pills can sometimes be problematic, because birth control pills mask what your natural cycle is doing. You're taking synthetic estrogen and progesterone, so you're getting what's called a withdrawal bleed. But that's not the same thing as when your pituitary gland in your brain tells your ovaries to make estrogen and progesterone and you get a natural period. For that cycle to happen naturally in the body, you have to have enough calcium, you have to have enough protein, you have to actually be of a certain body weight for your body to be able to do that. And that weight is actually different for every person. And so part of the issue with the birth control pills is that you sort of mask if there's this underlying problem in the physiology. And so I would make sure that a woman who's in her 20s or 30s and has low bone mass, I would make sure that she's able to cycle on her own. Because if she's able to do that, that sort of is one of the best indicators that your body has enough calcium, has enough protein, that you are an appropriate weight for your height.
Because part of me wants to ask the person that asked that question, how do you know you have low bone density? So you must have been worked up for it if you are saying you have low bone density and some sort of nutritional deficiencies. I think it depends on age is a biggie here, because if you're in your 20s versus if you're 25 versus 39, that's a huge difference. So again, you have to figure out what the root cause was, like, Dr. Starr was saying, and then kind of figure out what these nutritional deficiencies were from. Because we see it a lot of porous bone and, people with eating disorders or who had eating disorders. So
the individual did add that they had a DEXA scan after they lost their period.
There you go.
Okay. Yeah.
And that's actually very important in the workup for anyone out there who got periods and doesn't get them or isn't getting 12 cycles a year, is getting less than that. I would push whoever you're seeing, whether it be a primary care doctor or OBGYN, to send that screening bone density test to see if there's any, insult to the skeleton that's happened from estrogen deficiency, because that's really a biggie in women in this age group, estrogen deficiency leading to bone loss.
The last question, and we did briefly touch on it earlier, but two different individuals are asking for tips if they're vegan. So what would be your top 2 tips for a vegan individual to make sure that they're getting, the vitamins and minerals they need, and having those great bones?
So one, I would make sure if you're vegan, you're doing it in a healthful way. You are making, where you're getting your protein from, where you're getting your B12 from. If you're not supplementing, you're doing nutritional yeast. I think those are biggies. Calcium is virtually as much as I have had people kind of try to dialogue with me about it. You cannot, if you are not a milk drinker, or if you don't drink, Dr. Starr, what's the,
Heifer.
Thank you. If you don't drink any sort of, dairy, most people have no chance of getting enough calcium in their diet. You could eat cheese and yogurt, but most people are not getting enough cheese and yogurt in a day to really get enough calcium. So if you are vegan, chances are, even if you're having, because yes, there are in fact, calcium is an electrolyte, and it is in a lot of different plant-based foods, but in a much smaller quantity. So like white beans, or you would have to eat close to like a pound of beans, or like a pound of almonds, or a pound of broccoli to get enough calcium in the same serving as like 8 ounces of milk. No one has enough time in the day to eat all that stuff. So if you really just need to make sure where you're getting still a nutritionally sound diet, but especially in terms of calcium, most people do tend to need to supplement in some way or another. So you might want to use one of those milk alternatives or whatever, as, sort of as a liquid calcium in a way. But that is, vegans need to it's not just calcium and vitamin D, it is all of these, it's a micro array of nutrients. And B12 is always the one that kind of, sirens in my head for vegans. So.
Well, thank you both so much, Dr. Starr, Deb. I appreciate you taking the time to join us today. If anyone else has any additional questions, please feel free to shoot an email to pped@hss.edu. But besides that, I learned a lot. I took a lot of notes. So thank you guys for taking the time to share your knowledge. And I hope everyone has a great day.
Thanks. Thank you all.
Thank you.